All right. Well, welcome everybody to the Community Pharmacy More Profit Roundtable. My name is Breck Rice. I will be your host today. I am the co-founder of ServeRx. I've been helping community pharmacies now for about 22 years. And what we do at ServeRx is bypass the PBMs to help community pharmacies get the fair reimbursements they deserve. And everything that I talk about and do will be bypassing the PBMs to help community pharmacies. I also host the PBM Reform podcast on the Pharmacy Podcast Network and continue to invite lawmakers and other decision makers to the table to talk about PBM reform. It's never a fast process, but we are making progress. Sometimes I feel like, a little guy in a rowboat out there chiseling away at the big iceberg that's about to sink the Titanic. And even though I'm making progress, I'm chipping away as fast as I can. It would probably be better if the Titanic could just avoid that iceberg. And so that's the other podcast series. And what you're attending today is the mini version of the Community Pharmacy More Profit Roundtable. The full hour-long podcast is once a month on the second Wednesday of each month at noon Eastern time. I invite you to tune in. But this is the mini roundtable where we really just dive into the clinical side of what the future is for community pharmacy. I'd like to thank our title sponsor, RX One Shop, where they do the shopping, find the great deals so that you can save. So what we want to visit about today are some programs that through remote care that Medicare has CPT codes that they're covering. So if you look at the progress here, the first CPT code was the CCM, or chronic care management, that was covered by Medicare back in 2015. And then added remote physiological monitoring. I always thought it was remote patient monitoring, what RPM is. I think it's interchangeable. But RPM came onto the scene around 2019. And then the new kid on the block here is this remote therapeutic monitoring, which is a tremendous opportunity for community pharmacies because this is the first time this platform has been designed specifically to help community pharmacies better help your patients, and it doesn't take all the extra steps that CCM and RPM take. So some pharmacies have dabbled in doing CCM and remote patient monitoring, or they've been approached by DME companies to sell them devices to try to set up RPM, but there are extra steps involved. For instance, you've got to have CPAs or collaborating doctors. The doctor who is prescribing, or the patient's doctor, has to prescribe the therapy. And then you also have to be in network with the payers or be set up to do the billing for the CCM and RPM side. Those are not that's not the situation with remote therapeutic monitoring. RTM is a standalone, does not require the PCP, and all of the heavy lifting is going to be done for the pharmacy by Remote Care Today. So how did I get connected with Remote Care Today? I'm not an employee. I am simply an advocate for this program because of my podcast series. So I'm gladly helping to educate community pharmacies on this opportunity because it is a tremendous opportunity. Now, if you do want to expand your scope of services into CCM and RPM or even other clinical services, there is a path for that as well. But I can assure you, in the last 2.5, 3 years that I've been, preaching to community pharmacies that you've got to do more than just dispense medications. I've found more wrong ways to do clinical services than right ways. So we want to try to help navigate the right way for you. And so I've outlined just a three-step process here of being able to do clinical services the right way. So let me show you those three steps. It starts with remote therapeutic monitoring. Step one is the RTM program that we're going to share with you today. And if you don't do anything more than just step one, you're going to be so much better off for it, and your patients are going to be so much better off for it. There is no cost to the pharmacy, none, zero. You'll never be asked for even a dollar to go towards the patient education. That's all provided for you through Remote Care Today. And this is an amazing program that we'll get into the details on. Step two is being fully set up to do medical billing. And RTM, being step one by Remote Care Today, has partnered with the Independent Pharmacy Provider Network, or IPPNHub.com, if you want more information. But they've partnered with IPPN for a couple of reasons. Even though the patient's primary care provider doesn't need to prescribe RTM, a provider does. And the IPPN group, they already have about 5,000 providers nationwide covering all 50 states. And so they're helping launch the RTM. And then also the billing to Medicare is done through IPPN Hub. So that's what the partnership is there. And then step three is a full HIPAA compliant brick and mortar clinical room in your pharmacy. So it's a door within your door. You own it. Pharmacy owns the clinic, but it can be managed and even staffed for you. That program is BRIM. The partnership there is that no one can do a full brick and mortar clinic without step two. So step two is the prerequisite to doing a full clinical room. You don't, it's not going to be a fit for every pharmacy because you've got to have the space for it. Where IPPN is more of a fit for every pharmacy because a lot of the services can be virtual. But you don't ever even have to take step two and step three, like I stated before. You can do just the remote therapeutic monitoring, zero cost to the pharmacy, where the other two programs, step two and step three, do have some startup costs to them. So let's just take a few minutes to really discuss what is remote therapeutic monitoring and who qualifies for it. First, the medical conditions that are covered mainly are musculoskeletal disorders. Also, you'll see respiratory issues and then even some medication management. Symptoms that are covered are pretty broad. I'm not quite a senior yet myself, getting closer every day, but I would qualify. Sometimes I have pain and stiffness, right? So if you look at the center column there, you can see that those symptoms are pretty broad, but the outcomes are amazing for seniors specifically, even though remote therapeutic monitoring will also be covered by commercial payers too, case by case. So if somebody has had an injury that they're recovering from, their payer may cover RTM for them. But the easiest patient population to identify that will qualify are your 65 and older patients. And this program is addressing their two top concerns: loss of memory and loss of balance. Now, it'll address a lot of other issues too, like pain and stress and a lot of other things that this program is going to help with, but it really addresses those top concerns that seniors have. So why is Medicare really backing this and behind this program? It's because they're spending billions of dollars. Also, the leading cause of injury-related deaths today are falls, when a senior has a fall. So 50 billion with a B dollars that Medicare is spending to address falls today. They project that that's going to increase over to 100 billion in the next 5 years. They know that cognitive impairment attributes to more falls. In fact, there's a study that shows that patients with dementia are 300% more likely to have a fall. Another scary statistic here is that a senior falls every second of every day now. Seniors in their 70s, two-thirds of them are experiencing some kind of cognitive decline. And now about every 65 seconds, someone is diagnosed with Alzheimer's disease. Okay, these programs, remote therapeutic monitoring tools that are going to be introduced to you today, are actually delaying or even preventing dementia. Amazing statistic that's not listed here is that a patient that is involved in remote therapeutic monitoring is 75% less likely to get dementia. So I want to share just a 2-minute explanation about the program Brain Health Plus, which is the program that you'll be able to offer to your patients at your community pharmacy. And again, this can explain all of the wonderful tools in the program better than I can.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding...
Oops, sorry. Sure that's on.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one-of-a-kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug-to-drug interactions, and even geofencing alerts, so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part. We do it all for you. You get a fully turnkey solution. Flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy. Click the Book a Call button to schedule a demo and bring it to your pharmacy today.
So the program is covered by Medicare Part B. B as in boy. Don't stress. Most pharmacies are not in Part B. They're in Part D. D as in David, or D as in drug, because all the billing is done on the remote care today's NPI and not the pharmacy's NPI. Most Advantage plans will cover it. And your patients will know upfront when they do the onboarding, they'll go through an insurance verification, so they'll know exactly what's covered. And even, like I said, even commercial payers will cover this case by case. About 85% of your seniors will not even have a copay because they'll either be dual enrolled or they'll have a supplement. But if they are the 15% that do have a copay, they'll know that up front without any, they'll know it up front so that there's not any questions later on why they're getting a copay bill or anything like that. All the educational materials will be provided for you. It will be customized specifically for your pharmacy. So flyers, posters, they're even doing printing prescription bags for you. So the information will be right on the bag itself. They set your pharmacy up with its own landing page. So it's like your own custom website specifically for this program, branded with your pharmacy's logo and everything. And they'll even have you help you script a welcome video. So whoever the face is of your community pharmacy, you would want to have them, if it's a bubbly tech that all your patients know and love, have them do the little welcome. So it's a familiar face when they go to the landing page. And then they'll help with the patient outreach. They, meaning Remote Care Today, will help with the patient education. So let them do as much of the heavy lifting as you'd like. But they'll always do that through your own pharmacy's communication channels, never through a third party. So if you have the ability to do SMS texting for like refill reminders, or it's time to get your flu shot, they'll use that same communication channel. And even if a friendly phone call is made, it'll actually show up on the patient's caller ID as your pharmacy that's calling them. So never concerned that it's a third party that's reaching out to them. So the program, Remote Care Today's program, needs your assistance. They need your help with reviewing the progress of each patient. So that's why they're providing all of this for you at no cost, free of charge to the community pharmacy, because they need you to do the checks and balances or go in and do the assessment for each of the patients that go on to the program. This 30-second video will show you just how straightforward it is to do the assessment from the pharmacy.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
Shouldn't take you more than a minute per patient to do that review. If you notice that there is a decline in progress, you notate it, and that will let the care coaches know to adjust the program for that specific patient. The administrative service fee is $25 per patient per month. So it's a residual that builds month after month for as many patients as you put onto the program. So in this example here, 100 patients should take you less than 2 hours worth of work, would generate $2,500 for the pharmacy or $1,250 per hour. So an amazing program that will help community pharmacies better help their senior patient population stay independent longer and not stress about memory loss and falls. And so this short recap here in this video tells you what the next steps are.
To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll show you what we mean by a turnkey solution. We'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. And don't forget, you can earn monthly administrative service fees by reviewing your patient's progress. It's about better care for your patients, more profit for your pharmacy, all with a zero out-of-pocket investment. Let's get started.
All right, so I would encourage any of our community pharmacies that are joining us today, please get with the care consultant that invited you, and they'll get over the BAA and agreement for you to review so that you can get enrolled in that. It's a no-brainer to me because there's no cost to you. It's pure profit when you do the reviews, and it's a way to help your patients like you've never been able to help before. Now, if you do have interest in the step 2 in the Independent Pharmacy Provider Network, which is the fastest growing community health collaboration in the country now, with hundreds of pharmacies already in the network and several thousand physicians in the network. I believe they're in about 20 states now. Then that is a separate demo that can be arranged for you. But it's a tremendous opportunity for you to expand your scope of services. These 4 pillars here are the pillars for success. I can also assure you that if not done right, these are also the pillars for failure. You've got to have a proper patient engagement solution, turnkey software. You've got to have CPAs in place, the collaborative practice agreements. And you need to have those physicians who work with you, and that's all provided by IPPN. It's really a win-win-win. The patient wins because they have more convenient, faster access to care by going to a community pharmacy. The provider wins because he is still managing the care plan for the patient, and it's improving his quality scores, by the way, too. So his scores are going up, then he can also is eligible for a higher reimbursement. And now that patient isn't taking up a valuable slot on his already too full schedule, right? So it's a really good benefit for the provider or the doctor. But the pharmacy wins the biggest in this scenario because approximately 67% of all the bill charges stay with the pharmacy in this program. So even after all the overhead is taken out and even the providers are paid for managing the care plan, approximately 67% stays with the pharmacy. This is what turns a immunization into a preventative health visit. So you see here all the 99391 through 99397 are all the preventative health codes, and then office visit codes, et cetera. You need to know how to do that successfully in order to do it right. And then step three, last thing I'll share with you here is the full brick and mortar HIPAA compliant clinic, the door within the door at your pharmacy that is owned by the pharmacy, and it's even named by the pharmacy. So it doesn't have to say, that it's a Brim Wellness. Brim is kind of like the Intel inside. So you may have an HP computer or a Dell computer, but it has an Intel chip inside, and that's kind of what Brim is the Intel inside. But this three-legged stool here explains it really well. It's all of the build out and setup of your clinic, and then the managed services, managing the clinic. The second leg of the tool is the talent exchange. This is really unique because until you have enough patients to be seen, it would be not very cost effective to have a nurse or a medical assistant on staff. So this is like Uber for medical providers. You post a shift, a nurse or a medical assistant says, "Up that I'm available on that day at that time," and they fill the shift. So it's a pretty unique concept. But the third leg of the stool is what I'm most excited about. That is the financial vehicle. This is the pharmacy fund. It will help you set up and build out your clinic if you need it. But when you pay back the pharmacy fund, not only are you paying back the fund, you're actually becoming a cooperative member of the fund. So you're helping the next community pharmacy set up their clinic and earning interest on the money in that fund. So that is a financial vehicle that can help you get closer to that someday retirement when you're ready to hand your pharmacy down to the next generation of community pharmacists. So that has been our program today. I am going to open it up for questions here. We have about 5 minutes for any questions and answers. We're going to open that up here in just a minute. But thank you so much for attending the Community Pharmacy More Profit Roundtable. This is the mini version, and appreciate you taking time out of your busy schedule to be with us today.